Hey everybody, I'm Nina Crowley. I'm Sika's Professional Affiliations and Education Manager, and I'm here today with Kate Foos, and she is a physician assistant practicing in Atlanta with Banana Bariatrics. So thanks for coming on to talk with me today.
Thank you so much for having me. Appreciate that.
Yeah, well, I'm excited. We know each other from the bariatric community, and I know, you've been doing some new things, and I wanted to chat with you because the way you have been telling me about using body comp in your practice has really been exciting. And so I love a good advocate and, want to, share that message with other people.
Yeah, we love body composition. We use it all the time in our clinic on all of our patients that come in. So I work part-time in the clinic as a bariatric physician assistant, like you mentioned. And our practice actually has two legs. So we have a surgical side, which is what I do 100% of the time. And then we have a non-surgical side. But all of our patients use the body composition scale, and it's a vital part of my visit. I print off the sheet after they go on it, and I go through all the special, variables, and it's relevant. It's applicable to their goals, and we could definitely talk in more detail about how I use it. But very excited to have that in our practice.
I love that being just sort of part of every visit. It's part of the culture.
Yeah.
So tell me, what are the ones that people sort of connect with, the parameters that you like to talk about the most?
Well, just to back up, I think it just highlights the importance of having more numbers than just the number on the scale, because you know how bariatric surgery patients are. It's like they're so number focused, or can be. And, we want to nurture just a healthier mindset about weight. And so when you have more data points, it allows patients to give themselves more credit with really how their health is improving after surgery. So for us, when we get our print off, we have their body mass index, we have their weights. And what I love is that every time they step on the scale, we get data points that, syncs to their profile. So I can see the trends. So I see how, and I can show them that. And it shows them if they're in the red zone or the yellow zone and the green zone. So for those, aesthetic people who like the visual, this is really helpful to them to see, the progression of weight loss. We also have a breakdown on our sheets that is the fat mass percentage. So that's also really great to have someone going from the red zone to the yellow zone, but also the number, the fat mass in pounds. So I can show them and say, you weighed in with us last year, and this is how many pounds of fat you had of your weight. And now at today's visit, you lost 50 pounds just from fat alone, which is really cool, because then we're high-fiving each other. That's such a feel-good moment. And then we transition over to the skeletal muscle mass. And that also is a good patient education point, because I can show them, we expect you to lose some muscle mass right after surgery. So this is my conversation with like the 1 monthers after surgery and 6 months, because you're in a calorie deficit and you're not, I tell them all these things on some sort of activity restriction. But by the time I personally see them again at the 6 month mark, I'm like, we got to get your muscle back. We need you to look at what your baseline is, your nadir is from when you started, and recover some of that. We see a lot of loss in their torso. So that's another variable on the sheet that we review. I show them the picture of the person that has globally where all of your skeletal muscle mass is distributed on their body. And then you can see how the data point trends from the last time they weighed in, whether they lost strength or they recovered strength. And most of the time I see the most muscle wasting in the torso. So that's the core, the chest, the back. So in the beginning, we expect that just because of obviously the nature of abdominal surgery. But then I tell them, I was like, ensure that you're doing full body workout. So it kind of is a great segue into the conversation of the healthy habits we want our patients to establish with the bariatric basics of working out and incorporating strength training at least 3 times a week. And when they tell me they are, I say, okay, well, I can see that it's improving your lower body strength, but how about your upper body? And if they are, increase your weights. And we kind of titrate their goals and keep them on task to keep pushing themselves. So love the skeletal muscle breakdown variable. But my favorite part is the visceral adiposity variable on there. So visceral adipose tissue is how it comes up, the VAT. And, we always see a little spike up in the beginning, which we kind of expect after surgery, and then the steep plummet after surgery.
Mm.
So, when I see a lot of patients getting their visceral adipose tissue in the green, and my kind of spiel layman terms to them is, that's your liver shrinking. That's your waist circumference shrinking. This is when you step on the scale and you might get frustrated because you just see a number, but your clothes are fitting differently. This is improving your comorbidities and your health and reducing your risk, of cancer and all these things, because the quality of your health is improving on the inside, which you may not be feeling. And so
I love that. I love that parameter, for all of those reasons. And also, I think for me, when I've talked to patients going from, okay, here's BMI, sure, that might be elevated. Here's even body fat percentage. Yes, we're seeing that be elevated, but the location of where that is that's the real connection to that chronic disease. And I think you can sort of say that all day long, but like you're saying, with the visual and really seeing the change is really where, they can have some success. I think that's really a great way to put that.
Well, and success at any point in time in their journey, because you're going to see the steepest, declines in a lot of these right in the beginning when they had the most dramatic weight loss. But even in what I consider our veteran patients, like our long-termers after a year out, and we're in the refining and maintenance stage, and they're like, oh, I keep losing the same couple pounds, or the scale hasn't moved. But they've incorporated something new in their routine, like working out or just trying to do water aerobics, all these things, right? And so I say, well, okay, let's see why the scale hasn't moved. But they could have lost, X number of pounds and then gained muscle. And so the net difference doesn't display itself on the number on the scale at their own home scale. So that's why I feel like the body impedance gives you just, more of a breakdown of what these numbers are, just to encourage them and give them in a better headspace, which is a huge part of this. If our patients feel like they're making progress, and that's the other part I mentioned, it's we're not looking for perfection here, this all or nothing mindset.
Oh, yeah.
That's destructive. Progress. That's all we're looking for. And just getting back on track is super helpful, because when some patients just like the data. They're like, okay, I have the numbers, and that's motivating for me, because now I have a new goal and I know where I was and what I'm capable of if they have regain, for example. So it's just a great way to incorporate in my visit all of the goals, all the bariatric basics, the application of, what we're saying medically with the behavioral lifestyle. And I can give them the sheet of paper, and you have those patients that have their 3-hole punch binders. They're keeping all their data and stats
That's awesome.
closely monitored. Oh yeah, they've got the tabs, they've got our surgery manual, there are highlighters.
Well, and I think the ability to sort of really personalize it is important too. We're saying, okay, I remember for so many years sort of coming in as the dietitian after our surgeons would talk to the patients and saying, okay, let's undo all of that, mindset about the weight and the ideal weight and the weight loss. And just, it's hard to do when they're wrapping it all around that single number. So I like being able to say, here's some variety of data, but also that you would treat patients differently based on what those numbers are, and not just kind of that all or nothing thinking, but not just a one size fits all approach to, all right, because to me, eat less, exercise more, right? We all know that's biased, bad advice, and it's too simple to actually be helpful. But sometimes I hear eat more protein, lift weights, even though that might end up being the advice that we land on, I think it can have that simplified characteristic in a way. But when you see, here's why I'm making that recommendation, your
Right.
muscle mass started pretty low. So we're going to treat you, maybe see you more often, maybe have higher protein goals, maybe get you into, really preferentially lifting weights rather than more aerobic activity. And that's why. And you can see those trends. I think that's where it really kind of starts to all make sense for the individual.
Well, and it helps with patient retention, which is a huge part, especially in private practice, of just long-term care. Patients are excited to come and look at their numbers and see. And even with patients who don't have scheduled appointments, I always tell them, if you're local, to where our clinic is in Atlanta, just come in and just get scaled, because they like that information. And it's allowing you to give them, like you said, more personalized care, because they're looking for help, they're looking for reassurance, they're looking for all this on social media and even in our own Facebook group that we have, but it's different. It gets them in the door and it gets them recommitted to you in practice, which is great because then you catch things early on, and you can just keep them along the way. So I think it's a great tool to have, and it really just kind of modernizes your practice. It really sets you apart to have this ability to offer this great scale that a patient wouldn't have access to at home. So that's kind of cool.
Love that.
Yeah.
Well, you're like our spokesperson. I think that's that's amazing. Yeah.
Well, I stand behind it. I mean, I go on it too. And, and I'm guilty of like, oh, I don't know if I really want to look at those numbers and jump on that scale because it keeps you honest. But that's the accountability part of it too, which I think is important.
And I think that even thinking about it like that for yourself reminds you that there's such an ethical, emotional reaction to something that is pretty data driven, right? So if you can kind of help reframe that into here's numbers, it's neutral information, it can help bring people down, I think, from that whole angst that they had about getting on a scale that, we know, right. I mean, in our population of people with obesity, severe obesity, like they've had such a long history with that complex relationship with the scale. So it's redefining that in, I think, a much more positive way.
Well, to that point, I shift the conversation away from the quantitative data that the scale offers in terms of what the number is, because you said it yourself. It triggers kind of this diet culture headspace in our patients. And instead I say, this is more focused on the qualitative part of your health because I can see more information. And this is about health and longevity. This is for a lot of patients why they had surgery. And it's also a better snapshot because for some patients, the scale is like they're on it every single day. And they can get obsessive over, the ups, the downs. And I say, listen, if it's messing with your mind, just give it a break. But at least for us, like we have greater data points like spaced out because we're obviously not seeing them so frequently. And so it's a great reminder for our patients of how far they've come. Remember when this first data point, this is where we started. And yeah, you might see some blips up and down, but you got through the holidays and your vacations. So yeah, you're going to see some minor fluctuations, but zoom out and see the big picture of your progress and just get back on track. And I think that can be a mindset shift for them. That's extra encouragement in their journey.
I like that. Yeah. There is an ability too, if you've got several measurements, to deselect the middle ones and really show them the first and last. And I think that's, especially you and I were talking about the body composition chart where you're plotting muscle mass and fat mass. Mm-hmm. If you show them the beginning and end of a year, I think that's even more, there's value in the frequency of measurement to show them it's not a straight line. It's not, how our brain wants to think about goals and meeting them. But here's where you were at the beginning and here's where you are now. Like I think that's a real nice visual.
Well, and talking again about mindset is, a lot of the journey for patients after surgery is just helping them build more confidence in what they're capable of doing and allowing them to trust themselves in this process because they've lost trust in themselves before surgery because of all the diets they tried and how that kind of set them up for failure. And in that sense, they think that they're going to fail. And so that's why they're so obsessive about the scale. And, look how far you've come. You can do this. You are doing this. This is what the data is showing. And so just being consistent pays off and not having a timeline of, I just want to get down to this weight for, so-and-so's wedding. It's like, well, what happens when you get to that point? Do you just stop? So staying the course and trusting that they've already done it. They have the skills to keep doing it. And just to keep at it can also be, powerful for our patients.
Oh, I feel like we're very aligned on philosophy there. I feel like you've said it much better than I do, but I think that's totally where I've seen such, intersection of behavior change and life change after surgery, where it's just such a positive impact on what they can do and that self-efficacy. So I love that.
Yes.
I think in the other big piece, I also talk a lot about interdisciplinary care and support and how we're able to, integrate not just, we could talk a lot about how people view surgery and medication and all of that, but I do think it's a real disruptor in a positive disruptor in their lifestyle a lot of times to move them in a good direction. And then it is sustained by all that other stuff, right? So surgery and medications work on their own, but they don't work as optimal as they do without that whole team and that whole support approach. And I think that's, another thing that we've talked about being something that you offer. So I wanted to, give you a chance to sort of talk about what you do on in your free time and how you support your patients, because I think that aligns with the mission that we're all kind of after here.
Well, prior to us meeting, I was working on a prospective patient fears course because I'm really passionate about patient education. And I think, working in private practice now, we see a lot of fall off after surgery, and we don't have, like, it's hard for our patients, for us to retain patients, but we know they need support and care, but we know that they're finding it on the wrong platforms like social media and stuff. And they struggle with regain, and they worry that maybe they're embarrassed and they're going to feel like a failure, or they're going to get judged if they come back and see us providers in the office. And so I always try to harp on them, like, this is what we're here for, try to give them that encouragement. We're here to support you lifelong. But the reality is, this is a struggle that we're having nationwide, is just losing patients to follow up. And so they go on social media, and then they have regain, and then, or they fall off the wagon. And so how do we recover our patients back and offer support? And so my passion has been to do so. So I've actually built something called Banana Bariatrics, which is an aftercare program, and it provides support for everyone on their weight loss journey after bariatric surgery. So it supports them. We have weekly support groups, and we have education. So I have a lot of courses and a lot of engagement and accountability. More than just the practice Facebook group, we really get them engaged on weekly challenges and mentorship with one another and deeper connection. But from a private practice standpoint, what we find is, their patients have a lot of fears preceding surgery. So prospective patients, they're afraid that they're going to be a failure and their surgery is not going to work for them. And because, again, they're on social media and everyone's sharing their horror stories, and they're not connected to the right people and the right, team. So just educating them from a medical backed, place, and having a program set up where, hey, here's a course with, everyone, patients talking about their fears too, and being able to provide them education and hold their hand. Because ultimately it's about, from a surgeon standpoint, how can we maximize and be efficient and, maximize our potential of getting more patients to surgery that want surgery, right? Of course, that want surgery but are held back because they're afraid, or it takes too long to get there, or they can't afford it. But having a holding place where they can feel really connected to people in the practice. So when they get through, the support doesn't go away. And then they trust the practice to come back, because now they know, and they've been nurtured this whole time, that we're there for them, whether they need adjunctive therapies like medications or revisional surgery. But sometimes they just don't even know what they don't know, or they're not executing the basics consistently because they don't have the accountability or the support. So we just maximize with, like, all of that on steroids for them, so they can be as successful as possible, because that also makes my job easier. When I have a patient who is compliant with their vitamins, and now at 6 months, when I start repeating their panels, I don't have to, like, chase them down for all these deficiencies, which is a liability on our practice. And it's dangerous for them as a patient, especially our SADI switch patients. This is preventive focus. Sorry, I get real passionate about this.
No, that's great. And I mean, to me, it's also part of this whole, we've always had this model in healthcare, like, you have to come back to the office and to the clinic. And we know through, COVID and all the virtual stuff that, maybe they come in at their regular time points, but the check-ins don't have to be there. And so I think it's really progressive and evolved to be able to offer, them. And that's the real patient-centered care, right? Is you're meeting them where they're at. If they're going online, that's how they want to get and receive and interact with that information. We just know that it can be tricky from a psychological perspective, right? Or a safety perspective. So you're providing that in a way that is, meeting people where they're at, but with the, supportive evidence that they need to have that.
It just helps a practice, like, modernize, right, and meet the patients virtually, where it's immediately accessible and they can immediately connect with people. And that's the three things. It's just education, support, and accountability and connection, and I think it's been just a lot of fun. And it's multidisciplinary, to your point before when you're talking about how, there's more than just one specialty involved in a patient's care. And it's true. And I'm a physician assistant. And so I do a lot of the medical and the post-op stuff, but there's bariatric psychologists and bariatric registered dietitians and obviously surgeons and, psychologists, bariatric psychologists. Everybody is such a key part of this in the patient's journey. It really does take a team. And it takes a lot for these patients to feel supported, but they need it because they're not going to get that specialty care at their PCP, and again, this is like a whole separate conversation, but as a bariatric practice, you do have to centralize that care for that patient because they don't know, as a woman with their menstrual and they're having, ibuprofen because they're cramps and they're having that constantly, but they're a bypass patient. So some of this stuff, or they get a kidney stone and they get Toradol and they get NSAIDs and they just don't understand. So that's the importance of that support and retention and just keeping them inside the practice to just fill in knowledge gaps and keep them safe lifelong. And it's easy to say you want to provide that, but to be able to actually offer them something to provide them lifetime of care is different and is hard, but it's possible. So yeah, it's something I'm real excited about.
Oh, well, I love hearing that it's, that was, as a former bariatric coordinator, it was always, our goal to sort of figure out how do we keep patients that we know need us long-term involved when they're dropping off. And so there's so many, I think, different explanations or buckets or reasons that people, don't end up following up. And some of the ones you said were always interesting and tough for me. Like part of that is sometimes even we're so focused on that progress, not perfection, right? They're so focused on perfection, they worry they're going to disappoint the team. And, I talk to patients always in the beginning about that, about just, we're here for you. This is your story. It's not something to be embarrassed about. It's not something to not want to follow up. But I think, like you said, you've got to sort of make that culture and show them what that is before they can really take that leap in their healthcare journey.
It's trust. It's feeling safe. It's being able to be vulnerable, but it's also not about us. I think we get in the way and we're like, come back and see us, come back and see us. And it's not about us. It's about, I lost my headphone. It's about them connecting to other people. And so when I lead our support groups, our in-person ones, the thing that I love seeing after support group is they're having sidebar conversations. They're sitting down before they leave and they're swapping numbers. And that's really like inside Banana, we do the same thing. We group them onto teams and we have small groups so they can get to know each other because that helps them stick around and foster that community of trust. Because when they have a fear or they have a concern, they're not telling me about it. They're telling their friends inside the group about it. And same with the practice, allowing them, they share something in common and some don't have support. They can't go to their family for it. They haven't told people they've had surgery. So they can feel very isolated and like they're struggling in solitude. And that's like the worst thing that I want them to experience when we can offer a team, but more importantly, a greater community that's encouraging and is positive. Because you need all the cheerleaders with our patients you can get.
And they need to, I remember very much, thinking about how do you break up groups in different ways. And, I ended up always coming back to, in the beginning, you need to sort of see where you're going and see those long-term lifers, patients who've been coming all for 10 years or longer. But then I think there's also value in being that sort of mentor, and it reconnects you to why you did it and remembering where you were before you had surgery. So I think if you're able to do that virtually, that's even got much more staying power than, lots of other methods. So I love to hear that.
Yeah, we dialed up the support so we can segment more of our patients. So how we used to just have a monthly support group, but again, it's like you'd have the newbies come in and they have real concerns, but it's not relevant to a veteran patient, right? They have different concerns. And so being able to offer support groups just for men, just for women, a back on track group, a new patient group, and then a meal prepping group, which is a big part of it. I didn't even mention, we have a whole meal prep and planning part where we even have a meal prep support group where a bariatric patient leads it and she has like a homework assignment that they have to prep before so they can all cook together. So it's a lot of that like accountability, but now you're getting the specific support that you need on a regular basis And the virtual component is nice because if you can't make it because you work nights or whatever, the replay is still there and you can still connect with people after the fact. So you don't feel like you're missing out. And so that's been really great because, health is very holistic. It's not just like, yes, you need to meal prep, but like, where do you even start? It's like, how? Yeah. What foods do I have to buy? How do I even cook this? And how do I cook it relative to a bariatric patient who might have a partner who doesn't eat healthy and a toddler that is a kid? So it's like,
yes, that's totally, and that's what they're, ending up seeking out, on social media and other places that aren't, understanding of all the nuances there. I think that's great. I would have loved to have more of that kind of support for my patients too.
Yeah. It's been a lot of fun.
Well, thank you. Yeah, I really appreciate you sharing your experience and hearing what you're doing. I think this has been really valuable. So if people want to get in touch with you or send patients your way, how do they do that?
So they can email me at info@bananabariatrics.com and they can contact me that way. And patients in the Atlanta office, you can just email me too as well if you're looking to establish care in the region.
Awesome. Well, Kate, thank you so much for joining me today and being available to keep doing this really great work. I really appreciate it.
Thank you. And thank you for having this platform as well to spread your message. And thank you for the body composition scale. I love it. I use it all the time.
Awesome.
I stand behind it. So it's wonderful for our patients.
Well, great. All right. Well, I'll see you hopefully at one of these upcoming meetings here in the next year.
Absolutely. Thank you. Will do.
Thank you. Bye.